Across the US, around 80 people die each and every day from a heroin overdose. For some, the deadly addiction starts from what started out as a regular visit to the doctor where they're prescribed opioid-based medicines. His Caleb Mopin has more.
Dramatic rise in the heroin epidemic.
Investigators recovered 970 bags of heroin.
Public health, law enforcement, and social crisis.
Approximately 78 people die each day from overdoses of heroin and opiate-based painkillers. This is larger than the homicide rate. But studies now show that for the majority of Americans who find themselves hooked, the addiction doesn't begin with a reckless personal choice.
Go for
According to U.S. government studies, more than half of young heroin users aren't deliberately seeking a thrill through drugs. Instead, their addiction starts with something completely legal.
People go into an ER and they expect somebody to solve their problem. And that seems to be the answer.
They're not getting it, from dealers on the streets. It's coming from prescription drugs. They're getting their initial contact through doctors who mean well, and they're getting too many refills on their prescriptions, and they become addicted to OxyContin or Percocet. And once they crack down, the government cracks down on this, the black market prices for these drugs becomes astronomically high. And there's a very cheap alternative, which is street heroin, which is very, very cheap.
The world market is being supplied with cheap heroin from Central Asia, driving the prices lower than ever. Since the U.S. invasion of Afghanistan in 2002, the country now supplies more than 80% of the world's heroin, with street value 5 times cheaper than it was during the 1990s. Poppy fields are also rapidly sprouting up across Mexico, supplying more than half of the heroin in the United States.
There is no drug prevention, there is no drug funding for treatment. It's really tragic that in the Congress, they've passed a bill to redesignate drug abuse as a health issue, but they have provided no money for the treatment or prevention. So that is one of the reasons for the crisis, is they're really taking no action other than words.